Hello, welcome back to my YouTube channel. Myself Roja, and I have made several videos on mental health disorders. You can subscribe this channel and you will have a look at whatever videos I have made. And this channel is especially started with an intention of making several videos on nursing related subjects, and from now on I'm going to make some videos on nursing research and statistics, and these videos are mainly focused on exam point of view. So with an intention of that, I'm starting this video nursing research, and today's topic will be regarding the importance of nursing research for nurses and also characteristics of nursing research. These are the two aspects which will be discussed in this video. So before going, if you haven't subscribed my channel, I request you all to please subscribe my channel. So let's just straight away go into topic. Today in this video we are going to discuss about some of the aspects like definition of research, historical view of nursing research, and definition of nursing research, the difference between nursing research and research in nursing, characteristics of good research, importance of research in nursing. Exam point of view, Dr. NTR, University of Health Sciences, BSc Nursing 4YDC examination. Several times these questions were asked, and these are very important topics. Discuss the importance of research in nursing. 10 marks, that means essay type of question. It was asked in February 2022 and 2020. Explain the characteristics of good research. This is also a 10 marks question which was asked in 2021 and June 19. Question papers. Then coming to 5 marks question, need for nursing research, was question asked in February 2021. So before we could straight away go into those answers, I would like to introduce this nursing research topic. So coming to definition of research, this word research is derived from French term here, research here. So here we have a word research here which says like a re, it is a prefix, and search here is a verb which means search. So re meaning intensive, once again afresh. Search means to look for something, to just carefully observe something, or to get some information, or to test, or to try, or to prove, or whatever. It is like research. Whatever is there, you're going to do it again, find out something new from that, carefully examine. That's what it means. Coming to definition of research, it is a systematic method of exploring, describing, explaining, relating, or establishing the existence of phenomena, the factors that cause the change in that phenomena, how this phenomena influences other phenomena. So research means, how do you search? You explore, you describe, like explain whatever is there, you're trying to find out, and how you found out something, and how that whatever you have found is trying to influence other aspects of persons. Coming to historical overview of nursing research, I'm going to just tell in a nutshell form of it. As we all know, Florence Nightingale, she is the founder of nursing. So during the Crimean War, she gave nursing care to the soldiers who were actually dying because of infection. In spite of giving so many medicines, and still death rate was very high. And it was during this period, Florence Nightingale, when treating the soldiers during the Crimean War, she found out that the cause for high mortality rate, that is like lack of adequate sanitation, adequate ventilation, purity of water and cleanliness, and healthy diet, were the main cause of death for death of soldiers. So after implementing these aspects, the death rate has reduced from 42% to 2%. This is when they have identified, like, no, nursing research has started. And in India, the same Florence Nightingale, she reported that unsanitary conditions in Indian military men living in these areas were again cause for high mortality. So later, when in 1946, Boer Committee took a stand, and in that report it recommended that nurses need to get trained and they need higher education. So that is where priority is given for nursing and upgrading ourselves in knowledge wise and also research wise. So taking that report into consideration, Miss Edith Buchan from Rajkumar Amrit Kaur College of Nursing, she was the first person who is sent to obtain doctoral degree in education with the help of sponsorship of WHO. Later on, we have Miss Margareta Craig. She attended the International Council of Nurses meet, and she presented a paper related to the need of nursing research in India. So that's how initially nursing research has started in India. Another landmark in India is that in 1986, NRSI, Nursing Research Society of India, has been established with Dr. Indrajit as founder president and Uma Handa as first secretary. So Nursing Research Society of India, it is a portal, it is a way where the researches done by the postgraduates, the dissertations done by the postgraduates are communicated or disseminated to the nursing personnel. And there are many journals which are started, like Nursing and Midwifery Research Journal, and also Nightingale's Nursing Times, Journal of Nursing Midwifery, Journal of Nursing Research Society of India, and Journal of Nursing Education, Kerala Nurses Forum. All these are some of the important journals. Of course, we have many other journals as well, which are helping and supporting all the postgraduates as well as the graduates to just publish whatever they have found out, so that it will be helpful for the to upgrade our profession. Coming to this is all historical point of view. It's just an introduction part of it. You know what is research and what is the historical view of how it developed and all, and the role of Florence Nightingale in nursing research. Coming to the definition of nursing research, there are three definitions which are listed here. You can just, exam point of view, you can just clearly write down one or two. But if you just look down here, all the definitions, it says that nursing research refers to systematic, controlled, empirical and critical investigation in attempting to discover or confirm facts that relate to specific problem or question about practice of nursing. That is according to Walls and Burchell, 1981. According to Pollitt and Hungler, nursing research is a way to identify new knowledge, improve professional education and practices, and use resources effectively. Apart from that, nursing research is defined as systematic search for knowledge about issues of importance to nursing. Very simple, but it includes all components. It is a systematic search for knowledge about issues of importance to nursing. So, when we are providing nursing care to patients, we try to provide the best or the quality care which is effective. So, in order to provide effective services to the clients or the patient or service users, we need a lot of updated technology, updated information, and we need to upgrade ourselves, find out which is the best for the patient, and that can be done only by nursing research. According to Heck and Mule, nursing research is a systematic approach to gathering information for the purpose of answering questions and solving problems in the pursuit of creating new knowledge about nursing, practice, education, and policy. So, may it be clinical area, education side, as well as administration side, in order to provide the best of our services to our profession, to upgrade it, nursing research needs to be done. Coming to nursing research versus research in nursing. Even though we intermittently just exchange these words like nursing research or research in nursing, you need to have an understanding what is nursing research and research in nursing. When can you use these terms actually? Nursing research focuses on practice of nursing. It mainly focuses on nursing practice area, education and administration, to be in short. Nursing research, it includes all the studies which are done related to nursing practice, that is clinical nursing research. You can otherwise call it as clinical nursing research. Then nursing education and nursing administration. This is about nursing research. But when you use this term research in nursing, it is related to studies about nursing profession and the characteristics of a nurse. It includes historical aspects of nursing, ethical aspects of nursing, and political aspects of nursing. In a way, when we say nursing research, it is to practice, education and administration. But research in nursing is in a broader term. It includes all political, ethical, legal aspects and historical points also. So it is broader when compared to nursing research. And now you know where to use nursing research, that word nursing research and research in nursing. Now coming to the main aspect, characteristics of nursing research. So when we say a good research or research itself, we have said like nursing research itself is a systematic, logical, empirical. When we use this word empirical, that means that which can be observed. This word empirical means that which can be observed. You can show it. So good research is systematic, logical, that means step by step, can be observed, and replicable. When we say replicable, it can be repeated again and again, the results will be same. So in order to say that this is good research, it needs to have certain characteristics. So coming to nursing research, we follow certain characteristics like it should be orderly and systematic process as explained. sequential, logical. When we go through this research process, going through the literature, then identifying a problem, you have certain steps. So first point is that it should be orderly and systematic. Next, based on current professional issues. Yes, of course. So the problems what we are facing in nursing are not similar to those which are faced during the past years. So as the technology is increasing, societal changes are occurring, there are new disease conditions, we are facing new problems in implementation of nursing practice. So the research studies whatever we are conducting should be of current professional issues, so that they should be able to provide some solutions to the current problems what nurses are facing in all these other areas like clinical areas, administrative or education side. Next, should begin with clearly defined purpose. When you're conducting any research, you should have a clear understanding for what reason you're conducting that research. Next point, emphasize to develop, refine, and expand professional knowledge. Whatever knowledge which is existing related to what you're doing research, you're going to, by doing this research, you're going to add some more knowledge to it. And you're going to add some knowledge to the nursing profession on the whole. That's the meaning of it. Next, directed towards development of testing theories. There are different types of nursing theories, isn't it? Florence Nightingale theory is there, Oram self-care deficit theory is there, then Peplo's interpersonal theories, all these theories, so many theories are there, Roy's adaptation model, etc. etc. So whenever we do research, they either test theory, definitely you will include a theory in it, nursing theory, a conceptual framework will be included. So we try to test the theory which is developed, or sometimes we do nursing research to create a new theory. That's how it is. Then finding solution to problem. Another characteristic is finding solution to the problem. Suppose, for example, when we say like person is having asthma or suffering with some respiratory problems, and if we're having difficulty in breathing, so previously they have tried with steam inhalation, and they said steam inhalation helps a lot in loosening the secretions, thereby just making the lungs clear. So person can have clear breathing. These are all done by doing some researches. So by doing nursing research, we try to find some solutions to certain professional problems. Next, dedicated to develop empirical evidence. As said, empirical means that which can be observed. So good research always try to develop empirical evidences, that which can be observed. Next point, strives to collect first-hand information. When we say first-hand information, that means by doing this research, we collect directly from the sample by observing or by interviewing or by questioning. So information where you directly collect from the sample is called as first-hand information. And next we have second-hand information also. This is when we try to just gather information which is already published by the first-hand information. Next, another characteristics of nursing research is an objective and logical process. That's what. So it has certain objectives and logical process, sequential process is there. What to do, next what to do, what step, next what step, followed one by one. And we have certain objectives where we want to reach them. It uses appropriate methodology. So when we use this word methodology, it includes like what you want to do, population, selecting sample, data collection tool, and how you're going to collect the data, how you're going to analyze the data, analyze the data, then interpret the data. All that is included in methodology. So one of the main characteristics of nursing research is it uses appropriate methodology. Next, conducted on representative sample. So we select a population. From that population, we select a sample, and the sample is selected very carefully that once the research is done, the findings can be generalized to that particular population. Next, another characteristics is generates finding to refine and improve professional practice. This has been explained. So whatever data we gather, it is sent for analysis. Then whatever findings we get, these findings are mainly used to refine and improve professional practice. Then the next point, conducted through appropriate use of methods and tools of data collection. So whenever we collect any data, we use appropriate methods. What are the methods of data collection? We will anyway discuss in later. Then what type of tools or questionnaires what you are using. There are different types of sampling techniques, then there are different types of methods of data collection, interview, questionnaire, survey method, observation method, etc. And how you are going to collect data. Then use of valid and reliable data collection tools, that's what. Carefully recorded and reported. As much as possible, we should always strive to reduce errors in our data gathering, or when you're compiling the data, we should avoid as many errors as possible while reporting the data or while analyzing the data or interpreting the data. Next, coming to adequately and appropriately analyzed research. Then patiently carried out activity. When we say patiently carried out activity, doing research is not that very easy, isn't it? It needs lot of patience. It's not done in one day. It takes, some researchers do take years. So in order to carry out this activity, we need lot of patience. We need to invest lot of time, money. And the person, whoever is conducting the research, should be expertise. He should have interest, motivation and courage to carry out this research. And after doing the research, after getting the results, there is no point in just keeping those results with you. Those results need to be communicated, adequately communicated. Once the research completes, once it is disseminated or communicated, the findings need to be shared so that they will be useful for the others. So in a summary point of view, like if they're asking 5 marks question or something like that, I have just jotted down, like research is a systematic process, okay? It's logical. There should be clearly defined purposes. It exerts control over situations like variables, different types of variables under study. Then it is reductive. Okay, investigates on small sample. As said, like, we select larger population, but only small sample is selected to do the study, and it creates empirical evidence. Then it produces reliable results which can be replicated or done by others. When done by others, the results produced will be same as the former one, and it produces valid findings that are reproducible, accuracy in all steps, maintains originality, it meets ethical principles, informed consent is obtained from all the participants, it tests the theory or parts of theory, develops theory, it uses logical reasoning in generation of knowledge both deductively as well as inductively. And findings can be used for description, prediction, explanation of the phenomena of interest. So, this is all about the characteristics of nursing research or good nursing research. So the next topic is need and importance of nursing research. Mostly used as asked in 5 marks questions, this one. The most important purpose of nursing research is that nursing practice to have a scientific base or a scientific knowledge. As we know that we are serving society and the service users are humans, and we, with the due regard, we at all costs we want to provide the quality care and an efficient care where the service users appreciate, and we have a lot of respect from the society towards any medical professionals or the medical profession. So when we are providing nursing care to the patients, we have something like consumer's law. So the clients do claim for the best services to be provided. So in order to provide best services, we need to get updated in knowledge wise, technology wise, service wise. We have to provide cost effective care. That is one thing. And we are accountable to the patients for whatever care we are providing. That is also very important aspects. And apart from that, validates nursing as a profession. So to call nursing as a profession, each profession, when we say this is a profession, it has some educational standards, it has some autonomy, it has some knowledge base. There are some formal entries like pre-entrance exams, and at the end of the course we have each year we have examinations to prove that we are experts in that year, or we prove that we have theoretical knowledge as well as clinical knowledge related to the subject, and it has some professional standards. So in order nursing to be called as a profession, we need to have a research basis where we can say that we have a rationale behind each and everything what we do. So we know why we are doing, and that can be only provided or proved through nursing researches. So here is a valid point, like validates nursing as a profession. Next, nursing research refines the existing knowledge on nursing practice. So already there is a base here, and whatever we are trying to do, we are going to add to that base. That's when it is called as refines the existing knowledge on nursing practice. We are trying to improve the nursing services to the patients, nursing educations, how best we can provide education. As you all know now, the system of nursing education, instead of like academic format, it has changed into semester pattern of conducting exams, and we are having OSCEs. And apart from that, nursing research will also contribute to the nursing administration, nursing education, and different roles. We have several expanded roles and extended roles. These are all done, or these are all framed with the help of nursing researchers. Then the other aspect is provide scientific basis and demonstrate accountability to profession. So, in order to summarize this nursing research, nurses are able to do the following: describe what is existing, in nursing practice, discover new information, it promotes understanding of situation, classify information for use in discipline. And in a nutshell, I have summarized some points here. Anyway, these are all repetition of whatever I have spoken. So this is all about the importance and need of nursing research. So for today's video, we have discussed about definition of research, definition of nursing research, historical perspective of nursing research, and several characteristics of nursing research, or a good nursing research, or a good research to be called as a good research, and the importance and need of nursing research. I hope you all have understood these two topics. So thank you all very much for listening. We'll get back soon with an important question on steps in research process in my next video. So before we could move on, please don't forget to subscribe this channel and share to others. Thank you all very much. We'll meet soon.